So, Terry, tell me about you and give me a little bit of your background and how you got to this work.
Sure, let's go. I'm a business person. I'm an
Mm.
entrepreneur. I'm not involved in healthcare, never have been. I've been a frequent flyer, so to speak, because I'm involved in motorsports, skiing, those kind of things. So I've had my share of emergency room visits,
Hmm.
and so I understand how that works. In addition, my wife spent 34 years working in emergency services as a nurse, like you.
Hmm.
So I got an in-depth inside vision, but not being there. And so she was in emergency services trauma, and finally with Saskatchewan Air Ambulance as clinical coordinator, and so dealt with trauma and emergency. And I got to spend a lot of time with people that did work in emergency healthcare.
Mm.
Along the way, developing my business throughout the years, I was in the trucking and transportation business, logistics, and throughout the years, I was always interested in doing things differently.
Mm.
And so quality improvement is about change. So I was always about quality improvement in that area. In my role as a transportation logistics business owner, I had people approach me and said, "Hey, you ought to be involved in the Saskatchewan Trucking Association, the association that advocates for the trucking industry." So I stuck my hand up and said, "Okay, I guess I could help out." And I wound up 10 years on the executive and concluded my term there. And when I sold my business as the president of the STA, lobbying their governments for improvements in safety, improvements in things that the industry needed to grow, to change, to do things. So that's my background. We moved to Candle Lake, and here I am. Now I'm a home builder, but then, well, somebody said, well, you should run for council. Our little village needs some things that probably could be improved. So I stuck my hand up and I said, well, if I'm going to do that, I'll run for mayor. So I got elected, and was very fortunate to have an awesome council elected with me, and we facilitated change. So
Nice.
now we've got Candle Lake organized. It's a thriving, growing community. And then my wife was retired. And I said, Marianne, we've got a lot of things going on. We've got things changing. Things are improving. We've got funding for a new lagoon. We've got funding for a new infrastructure, funding for a hall renovation. We've got all kinds of things organized. But we've got a little health committee that's kind of struggling. And, they're doing letter writing campaigns, and our little clinic was pretty well staffed up till 5 or 10 years ago. And now it's just struggling along. So, geez, Marianne, you might be interested in joining that little health committee. So she did, and I came home and I asked her how it went. And she said, well, I think it went well. I said, well, so what'd you learn? Well, I learned that I'm the new chairperson. And
That's the way it works.
yeah, and so she did that, and we worked together, the mayor and her, and then we had some new additions to that health committee, and we came up with a strategy, and we said, we've got to change something. Something needs to work with the SHA. We were having little meetings with the SHA. We went to the ministry and said, what would it take for us to get a little more engaged with you? And what if we asked you a different question? Our question was, and this should be a question for every small town, our question was, is there a greater role for rural communities to support or enhance health and wellness right in their own backyard? So that's how we've moved. So we're engaging, and now with volunteers to work with the system to improve health and wellness. And in our case, it's especially for seniors.
Mm.
So that's my brief little story.
Wow. And I love that you've got the heart of an improver. You think of quality improvement in healthcare, but there's people with the heart of improvement in all kinds of places in our society. And it's really cool when they join forces together. That's awesome. And Dr.
Yeah.
Al Hassan, I love that you guys also have found each other because your paths are quite different, and yet you've kind of converged into this like collaboration and partnership. So tell me about your background and how you got to this work.
Absolutely. Thank you very much. And yeah, you're absolutely right. Just listening to Terry, I see how, different our backgrounds are, but also how similar they are in that we're, doing something together now, which is fantastic. So um I I came here, and by here I mean to Saskatchewan 10 years ago. So I'm originally from Ghana, where I was born and raised. I grew up in a small rural community, I would say, in a very, very different social, economic, political sort of context than this place.
Hmm.
And growing up, I did see lots of things that would have inspired in me a desire to change and improve my society. So, we're talking women dying while trying to give birth. We're talking, children walking very long distances to get to school. And we're talking like health system infrastructure that is crumbling. And part of that was tied to lots of political and economic policies. So that background was what inspired me to actually pursue a degree in health administration in Ghana. So most of my former classmates are managing hospitals in the country
Hmm.
right now. So that was my original interest in understanding and improving health systems. And I got that training. And honestly, as part of my training, one of the big things I started to understand was that health systems exist in political systems. And so politics and political decisions determine and influence how the health systems themselves function. And so this insight actually pushed me to pursue another degree in global health. So moving from managing a hospital to like understanding the global health system.
Hmm.
And so that became my passion, right? So I moved to England, did that degree, and became all about that. And when I was there, I kind of decided to move to Canada to pursue a PhD. And that's what brought me to Saskatchewan. And so at the time, immediately I landed here, I was actually more interested in the health of immigrants because I am an immigrant. And so that was one of the first things that I cared about. And I was very excited. I wrote a proposal. I was like ready to pursue a PhD thesis in that. But I arrived here on September 2nd of 2017. And then I think the next day there was like a protest in the city because the government had just shut down the STC in May of that year.
Right. And
So
STC is the
STC.
Saskatchewan Transportation
Quotation
Company.
company. That's right.
Hmm.
Yeah. So
Hmm.
this was the main intercity bus system that they had. And so that was the first time I ever heard of that, right? I didn't know anything about that company, and but my supervisor and those that I had just met in Saskatchewan said, because again at that point I was all about how politics makes actually
Yeah.
a former master's thesis supervisor wrote a book titled How Politics Makes Us Sick because they're all always connected. So that's how I got into the world of like transportation and transportation as a social determinant of health because we already
Hmm.
knew that housing, transportation, food insecurity, all these things make people sick or not sick. So that's how transportation became one of the potential things. So I went to a few of those protests, saw people, understood their cause, what they were talking about. I met lots of people, some people who were blind and couldn't drive, some people who had relied on, that system their whole lives. And there were other things that they were protesting. And so I had decided at that point that I was going to investigate how government decision to end access to transport or close down a company, how that might affect the health system, how that might affect the health of individuals, how that might affect the health of people and communities. And so that became my new passion. And that, the struggles that I was seeing here were not that different from those struggles that I had seen in Ghana, where people might, like I was saying, die on the way to hospital because they couldn't
Hmm.
get there. And so for me, it was that wherever I am home, and I can align myself with people who are trying to improve systems in those contexts. And so that background and that work led me to writing a thesis, right? So I ended up writing a 300-page PhD dissertation about the decision to shut down the STC, the health impacts of that. I became a bit of a transport expert. So my world is primarily how does politics make us sick? And I do that investigation through research in different aspects. I'm headed to the World Health Organization headquarters in Geneva next month as part of the World Health Assembly, because that's like the global level. This is like
Hmm.
how politics makes us sick at that level, but also local, because we always must do the global and the local together. And so the HQC work kind of emerged in that more and more people were seeing what I was producing with others about how transportation is a big social determinant of health. And so they reached out to me at the time that they were creating the Thrive at Home community because they had identified transportation as one of the big pillars for improving the health system, but also improving people's ability to age in place and things like that. And so that's how I got pulled into this work. And it has been a great opportunity both to continue to share what I have learned from my research, but also engage with folks who are trying to solve the same problem that I
Right.
have seen, which is the problem of not being able to get where you need to go, whether it's to the hospital, but also whether it's to see your family and friends. Because a lot of the time, when people hear the transport health connection, they just think more about you can't go to hospital, so you're sick, and that's the
Hmm.
bad thing.
Hmm.
But it's obviously much more complicated than that. It's more like you can't go see your family. That
Right.
leads to you being lonely,
Can't
which
get to
leads to
Coffee
you being,
Row.
yeah.
It's a big
And
part of rural life. Yeah.
yes. So all the way from, those things to loneliness, to isolation and depression and things like that, to you being sick and that leading you to the hospital and that leading to the hospital having to take care of you more than it needed to or intended to. So those are some of the things that I have been doing, and that's the path that kind of led me to the Thrive at Home work that I'm
Hmm.
involved in now. Yeah.
Amazing. And so, Terry, I remember you from sitting at my table a couple years ago at a workshop that the Health Quality Council had put together. And their initiative was called Thrive at Home. And it was about helping older adults age in place and thinking about what everybody could do and work together to advance that work in the province. So, can you tell me about your journey in participating or linking up with the Thrive at Home initiative, and then how that connected you to Dr. Al Hassan?
Um, yeah, how that connected me to Jacob. It was actually really interesting, and I value our connection. Again, Jacob said that we come from different perspectives often, but more often we have the same goals.
Right. Yeah.
So that's
You're
that's
connected
really
in a shared purpose almost.
one of the very first things that we did when we started speaking to the ministry, if you'll recall that way back when. We were having some really good dialogues with them, and they were encouraging us. And they got politicians involved,
Hmm.
and the politicians helped us. So in our particular case, and Jacob, how does politics make us sick? But I take a different approach to things. I understand politics can do that, but how can politics help us? And
Hmm.
that's what I've always done. I've worked with so many politicians from well, both flavors of the government in Saskatchewan over the years to facilitate change. So we got connected by the Ministry of Health. They said, you know what, you're onto something here. And we just heard about a program that's being done by the Health Quality Council called Thrive at Home. You folks need to be connected. So they connected us, and it's been, let's just call it almost a marriage made in heaven because
Hmm.
we were looking for the things that small towns could do. And what we didn't realize that there were dozens and dozens of other small towns, small organizations that were looking to be connected. And everybody was working on their own little thing. Everybody was talking to their local politician or having their own little letter writing campaign, or they were just struggling along. And so we took that opportunity, got connected with the HQC, and we started moving our program forward. Now, then we got into actually a formal agreement. We have a pretty simple MOU with HQC related to the Thrive at Home project. And we said, you know what, if you help us out just a little bit,
Mhm.
then we will only do things to the best of our ability that can be templated, that can work across the province. So our transportation little initiative is one of those things, but we have initiatives on the three pillars of Thrive at Home, transportation being one, home supports being another, navigation through the system being the third.
Okay.
And then somewhere along the line, somebody figured out I had a transportation background,
Mhm.
and I got a call and said, "Hey, we've got one really good leader. All of our hubs have two. Would you be willing to be one as well?" And I said, "Sure." And then I met Jacob, and here we go. And we've had fun.
And what were those initial conversations like? What came out as your common goal or what you wanted to work on? How did that come about?
I can take a crack at it. It's been a while now, but I will say that so for the most part, the good thing about Thrive at Home has been that they have had such a solid structure that
Okay.
it has been very easy for us to navigate the path forward without necessarily having to determine too much on our own, right? So we have had to bring resources, we have had to figure out and chart a path to some extent, but they have had such a solid structure,
Mm.
like a working group that is already set up for us. They have a support person who has facilitated the meetings and everything. But I think, when we first met, we kind of had conversations around just transport as an issue and how it affects the well-being of older adults, particularly in rural context. I learned more about Terry's background, in local politics in his community and some of the things that they were already doing. And I think one of the things that, came through very early in our conversations was, Terry's interest often in kind of thinking about solutions as much as possible, right? So, for me, like I'm an academic, so my interest is solutions, of course, but I'm also very interested in understanding why we got to where we are in the first place, right? So even when I see how politics makes us sick, it doesn't mean politics cannot make us well, right? When
Hmm.
governments spend the right way, if governments put money in the right place, if governments think of people's health not from the perspective of profit or business per se, but more from the perspective of human rights and things like that, I think it makes a difference. And so
Yeah.
we have to always understand that as clearly as possible.
From my perspective, and I'm sure Jacob would share this, but I'm a little less delicate than him, and that's meant in the positive way. But I said, okay, well, we're coming at this from a couple of different angles. I'm an entrepreneur.
Mm.
I've learned by a lot of mistakes. I'm not an academic, but I've done some pretty successful things. And but I have what I call letters behind my name. Some of those would be GSD. I get shit done.
Right.
I try to. You don't always do
Yeah.
it right, but if you don't try something,
Yeah.
you don't know. And like so, now we're talking about quality improvement. We're talking about in our transportation hub testing
Yeah.
things. Well, I don't know how many times did Thomas Edison test a light bulb?
That's right.
You
Continuous
know,
learning and improvement. Continuous
Yeah,
learning and improvement.
and
Yeah.
fail and
Yeah.
fail and fail. Fall down, get up again. So that's where I come from, and it was pretty apparent pretty early on that we were coming at this from a couple of different things. Jacob was looking into the past to analyze what had happened and the impacts of those things, but I heard something about a race car driver once that said, "What's behind you is not important. You can learn from it,
Mm.
but just move ahead." And so that's where I go. That's kind of how I approach things. So it can be scary for people,
Hmm.
and it can get me in a lot of trouble.
Hmm.
But what I'm really valuing now is Jacob and I are learning from each other.
Yeah.
Like I'm learning from his uh, different, perhaps wiser approach to things. as opposed to my just stumble ahead and see what happens.
Well, to me, this is, and this is what I saw at the March workshop, is that you guys are so different, and yet you're appreciating the learning that you get from each other. And you almost find something that works more in the middle between the two ways of doing it. There's kind of like a third way that's really working well for you and this initiative. So, Jacob,
Well,
oh,
I have a friend that often says, you know what? If two of us thought exactly the same, we wouldn't need one of us.
that's right. That's right. Yeah, that's great. So, Jacob, I really was interested in the way you applied your academic research. I think you hired maybe a research assistant to do a bit of analysis that focused on learning about what the province was doing. Can you tell me about what you did with that?
Absolutely. And, just before that, I just wanted to agree as well that, having different perspectives is absolutely essential and it has come through in our successes, I would say. So, like there are connections that Terry has that I don't have that have been very valuable to us. There are insights and methods and
Yeah.
approaches to finding things that I have that Terry might not have that has given us access as well to information that we might not have. So I deeply enjoy working with Terry in that it's not always going to be easy, obviously, because we
Hmm.
have different perspectives, but the results speak for themselves. The things we
Hmm.
produce speak for themselves. Like we have things to show for our collaboration. But essentially, the part, so as we're giving you the background of how we ended up working together
Yeah.
and we didn't thrive at home. The idea was, like what strengths could I bring to this project and what strengths could Terry bring to the project? So my part was, if you're an academic, the things you do are you write grants, you do research analysis, you analyze data, you can write stuff up, you can disseminate them, you can show insights, you can see patterns that might be harder to see. So that was the first thing I did within the Thrive at Home was to lead us to obtain research funding to be able to do an environmental scan of
Hmm.
transportation initiatives that exist in Saskatchewan. That's one of the things we really wanted to know as a group was, so Terry has talked about, we wanted to sort of try some promising practices and see if we could even test something that works to be able to say, see, this works. But we said before we do that, right? So it's the same tension about the past and the future.
Right.
I was more thinking, okay, let's get the current state of affairs before we can test anything. Like, let's see a wide range of what is available and then
Hmm.
pick one of them as a really good example and potentially like test it and tell people, see, this works. So we got the money. We, very thankful to the Saskatchewan Health Research Foundation because we applied for a grant. They gave us the money. I hired a master's student from within my department, and we used the methodology that I will say, we wrote a paper. For different projects using a very similar methodology. And it's a very useful way for us to kind of get a sense of what's working. So we basically develop a search string, so like a series of words that would potentially help us identify transportation related initiatives. So like think of all the different ways you could say transportation, right?
Hmm.
So bus,
Rides.
taxi, rides, shuttle, all the different ways of saying that. Then we essentially use that to write a code. So we looked on Facebook, we used like Google, we used like 233. We just used all the possible places. And so through that, we got like a whole bunch of hits. And then the research assistant would clean this data. That means like he would look through and actually delete the things that are just false hits or they're not a real thing.
Right.
And
Like
so we
you took out the Rough Riders football
yeah,
team.
yeah, exactly. Yeah, exactly. If there's anything like that, we'll like remove those. And then we ended up with a list of potential initiatives that are in the province right now and
Okay.
possibly offering transportation for people within the province. So these are like a very wide range of initiatives. We identified 92 initiatives in like 75 communities in
Mhm.
Saskatchewan where there was some kind of initiative that we could find using our methods. We found those ones and then we collated it into a big Excel sheet. which we shared with our partners as a group. So then we then went through a process of trying to phone up as many of these organizations as possible to verify, are they still there? Are they still
Hmm.
operating? What challenges might they have? And things like that. So that's kind of the approach we use, and it helped us to really get a sense of what is happening right now in terms of communities responding to transport gaps and barriers in the province.
Okay. And so after you phoned all of these places and learned all about that, what kind of rose to the top in terms of your learning and understanding? What did it tell you?
So what I learned in looking through it, and I made a couple of those calls myself, we found that there were a lot of programs operating in the province. A lot of them were the typical Saskatchewan, might be across the country as well, but oftentimes a handy bus tied
Okay.
to a facility, a care home, perhaps funded partially by foundations in the community, in some cases, perhaps with a little bit of SHA funding, sometimes with paid drivers. But some of the little community ones were using volunteer drivers with their own vehicle. We found that many of them were functioning okay, could be better. Their vehicles were getting a little older, but we also found that ridership wasn't necessarily huge, or it perhaps wasn't the right vehicle at the right time for the right place.
Mm.
From my perspective, um, what was missing was something that was nimble. And that continues to be, for me, something that needs to be addressed or considered. We need to be nimble, so that's what we're beginning to learn. We haven't done the deepest dive into that yet,
Mhm.
Jacob. I think you'd agree. And but we did identify some really cool, promising practices.
Okay. What's one example of a promising practice that you've seen, like a community that's really impressed you or where it seems like it's working really, really well?
On January 22nd, we presented the results that Jacob and student Bernard did, and to a group, and it was well attended. It was over 30 people, but they were kind of the right people from a broad mix across the community.
Okay.
And so we talked about Jacob's report and the data, but then we talked about some of the promising practices that were emerging. One or two communities had already emerged by buying or funding in some way their own minivans or an SUV, 5, 6 passengers. So in those cases, they were spending between 80 and $100,000 and then put together a volunteer organization to run and operate those vehicles.
Okay.
So they were doing that, and then they were coordinating rides, booking the rides in advance so that people as individuals could get to the next largest community. So one of those examples was Gravelburg
Mm.
in Saskatchewan, and they have something called the Gravelburg Cares Shuttle. That's operated by a group of volunteers. They're funded by fundraising. They got some initial funding from Health Canada to set it up, but they have no sustainable funding, so they continue to struggle. From that model came another community that said, hey, that seemed like a good idea, and that was Indian Head. So Indian Head absolutely copied shamelessly the model that was in Gravelburg. Gravelburg helped them out, and they went out and they bought a minivan, and they are doing the same thing. And so they book that thing 2, 3 days in advance. They have a little dispatch system. They're struggling with that a little bit
Yeah.
because they use a combination of Google Sheets and a bunch of other things, and they coordinate that. So that was one of the promising practices. But the other one that was really promising and affordable was what's going on in Strasbourg, Saskatchewan.
Okay.
And that program has been going on for over 3 decades, and it's been successful. So they have a program where volunteers much prefer to drive their own vehicles. And so over the course of time, and I don't know how many years that's been, they have a program now where volunteers provide their own vehicles. The clients book their rides 3 days in advance. but the volunteers use their own vehicles. So what that is, and what that's identified to me as something that's affordable for a small town to do, that might gain some support from government or the SHA, and from my estimation, almost certainly will, because it's almost free. And there's nothing that will pique a politician's interest, then it's almost free. And our research after that led us to do some more research across the country to find out what programs there are, how they're facilitated, how they deal with things, even for example, like insurance, and what can we do to put together a program here in Saskatchewan.
Okay. So now are you guys focused on sharing these results, giving examples to people, encouraging them to connect with each other, to learn and develop in their own communities? Or what's your next steps, Dr. Ellison?
Yeah, that's a good question. And like Terry said, we've identified so many initiatives. Sadly, we haven't had the opportunity to talk to every single one,
Uh-huh.
which is very unfortunate because there was also like this Cote First Nation transportation service that we found, which was a transport service that is within a First Nations community. So there's like all these variations. Some of the
Mhm.
services we have found are like literally free, like completely free to use, which is, very, very significant for people who may be facing cost barriers. So we're trying to figure out a way of supporting our community partners as much as possible. We're starting working on creating a how-to sort of guide for communities that might want to start something. And I think, Terry, we will hopefully spend some more time to think this through. But there are lots of things to think through about, where are you going to get the funding from? So we will try to
Mhm.
get a list of resources that we have come across that might help people. You could apply to this, you could apply to that. And I think as well, Terry, some of the things you're saying about some of the organizations in terms of like the ones that may have challenges with tracking the information, or there are things we could create. And I think we will work together to try to create little templates here and there that we could hand to a community. Okay, this is where you could potentially look for money. These are the challenges you can expect potentially. If you start having people, this is how you could track who is using the service. Like we'll try to provide a suite of resources like that so that communities that are interested, and we have partners from Aberdeen who don't have this and have been following. We have
Okay.
a colleague, Colette, who has been part of this work and is like lobbying and working and trying to get something going in her small community. So for someone like that, like the resource we would create, she could take it as a template and she could look at what's really on
Mhm.
the ground in Aberdeen and then decide, okay, this makes sense for our context.
Mhm.
But then we would be able to use some of those resources. And we are sharing as much. A big part of the reason we're talking to you is that we're trying to disseminate what we have found and let more people know what we have found. Because I think a lot of people don't know as much about what's out there. Most people just know what's happening in their community
Yeah.
specifically, that they have or do not have a transportation initiative, but they don't know if most initiatives are phone based for booking or online. They don't know how
Mhm.
many exist. They don't know what's the proportion of rural versus urban. They don't know what challenges everyone seems to be running into. So having a resource like the one we created, the environmental scan we ended up doing, it culminated in a report that's almost 20 pages. And so it has like a lot of what we learned so far. And the new thing we're going to create, which is the how-to guide, will be a more practical resource for those who are at the stage of trying to start something. So we'll have to figure out the best way of sharing that guide as well so that more communities across the province who have the capacity and the interest and the need would be able to work together to draw on the guide to be able to start initiatives, but also more importantly, to sustain those initiatives because a lot of the time starting something and sustaining it are two different
Yeah.
things. Yeah.
Yeah. And I hear a lot of your work focuses on the local and maybe at the municipal level, but as you said, health is political. Are you also looking at, lobbying efforts at a provincial level or advocating for infrastructure that can keep these programs sustainable, to develop them or sustain them?
For me, that
Go ahead, Terry.
for me, that's That's absolutely a long-term goal, and I talk about
Mhm.
sustainability often. Like if we get this guide, and we're working on that, we almost need funding for the guide. But I think we've got a path to get something started here. Health Quality Council is very engaged in working with us now on, we've established just at a recent meeting what are our next steps, and the guide has become a priority. But in order to have the sustainability for these programs going forward, we need data. We need to be able to
Mhm.
prove to the politicians, to prove to those people that might fund something in the future, what's working, what's missing. It's hard to measure something that hasn't happened.
Yeah,
So we have that issue. Like, okay, so Mrs. Smith didn't get to her doctor's appointment. How do we know how that affected her?
right.
So we don't know, but what we do know is what we can collect. So what we've also come across, and Jacob, I'm glad you mentioned Colette and the wonderful folks at Aberdeen. They showed up at our event. Colette's trying to get local support. So she brought along an RM person, like the rural
Hmm.
municipality,
Hmm.
that she's trying to drum up that interest at the local level for that support. But remember, health care is not the responsibility of a municipality. And every small town mayor and councillor and administrator will say, oh, healthcare, you need to talk to the province. Don't come talking to
Right,
us.
right.
What they don't understand that wellness is part of their community, and talk about the challenges in the bigger cities around health and wellness and how it affects their policing, how it affects everything in their community, that
Mhm.
social element. So that that's where it's an issue. So we've just recently have a new person join our Thrive at Home. So we have people. Don't forget, I'm not from a healthcare background. Many of the people in the Thrive at Home program are
Mhm.
involved or even paid as part of their jobs. We have a lot of little nonprofits and other people that aren't, but we also have a couple of private operators. For example, the folks from Qualicare in Regina
Okay.
are involved in probably the home supports hub as private operators. So now we have a little operator in Saskatchewan that has an Uber type software program, and it's called Booker Rides. So we reached out to him and said, hey, we've heard a little bit about you. Folks in Swift Current had heard about him and were playing around with their seniors transportation program. We said, you know what? Can you tweak your software? And can we give it a bit of a flavor that just focuses on seniors? Could it be Booker Rides for seniors?
Yeah.
So here at Canada Lake, working on our transportation program, we're working with a private provider to tweak his software, collect the data, and make sure that we have that so that we can track that. And then we're asking him to create a template that any small town in Saskatchewan can use.
Uh-huh. You guys, this is so interesting and exciting and innovative. And, there's this concept of network weaving in health system improvement where you take different networks of people and you mix them all together to generate new solutions, new ideas. And I just think that what you guys have done is really sort of the best example I've heard of bringing different people together to solve an issue and sharing and learning from each other. And I just think what you're doing, I mean, it makes a lot of sense, but I think people underappreciate how much work and how much effort it takes. But it has real potential to have such a huge impact in actually changing the lives of older adults in the province and potentially across Canada. So I can't commend you enough for the work that you've done, the collaboration that you've built, the community of players that are involved. And I think this is really exciting. What's your vision of the future? What's your goal? Or how would you be happy when this is all done of what's left behind from this work?
Well, let Terry have the last say. I would say that primarily, my motivation is health equity.
Yeah.
I want to live in a society where everyone has the opportunity to live a healthy life, and that the governments, the people in authority, so governments at different levels, families, there's all kinds of people in different levels of authority, are able to step up, and that when people become vulnerable because of age, because of disability, because of whatever reason,
Mhm.
that we do not build systems that isolate those individuals and let them live lives that are less desirable than they would want. And so this vision for me involves, governments giving resources, governments listening to their constituents, because governments don't exist without constituents, right? People elect people into power. And so governments always need to bring their ear close to the people. I think a big challenge that I have found in a lot of this work is, I'm a researcher, and this is going to surprise you, but it's not only about data, right? Like we do a lot of analysis, we do a lot of research, we gather a lot of data. In my experience, it's often when data aligns with the understanding and vision of those in authority that the change actually ends up happening. So sometimes you can gather all the data and have all
Yeah.
the evidence and think that this is like completely incontrovertible and have nobody use it to do anything to
Yeah.
improve well-being, right? So for me, like I think on the one hand, I know what would be good, which is the equity that people getting where they need to go, and us creating a just society where nobody, because they are old or because they have a disability, cannot get there. But I think to get to that vision, it will involve whoever is going to control the resource, in most cases the government,
Mhm.
listening to the researchers, the community leaders, the people who have worked to move us towards this vision, so
Mhm.
that they can release the resources. And resources are all kinds of things. Even my time is resources, your time is resources. So
Mhm.
there's all kinds of resources that all of us have to release. But in most cases, it's money that someone
Yeah.
somewhere might have to release. So let's first of all have that vision, which is equity. We want fairness. We want everybody to live a life that we can say we live in a just society. That's the first part. And then the second part is let's listen to the data and not just, do anything else. Let's try as much as we can to let the data lead us and guide us. But again, it's not that black and white. In most cases,
Mhm.
you can have data and it might not lead where you want it to go. But in the end, equity that's the principle that is at the heart of everything that I am doing.
Yeah, and I hear you saying too that as a public, we need to speak up too and tell our leaders that this is important, this is a priority, that they want to see resources invested in this or they need this service in their community. And that's a powerful tool that we should
Absolutely.
mobilize as well. Yeah. And
Absolutely.
Terry, last word to you.
Okay, well, I'll start with that. So we need to tell. Every politician will tell you that they have armchair engineers, armchair consultants. Everybody wants to tell them something. But I think it's important that we need to show them something.
Okay.
And so for me, what success looks like in the coming months and few short years, because I'll be a senior soon. I will be an older adult soon.
Mhm.
I'm only 70 right now. And there will come a time when I'm going to need those services. So I'm in it for me, along with my other older friends. But so we need to show them some success stories. So what I would like to see over the next little while are some of these small little, and I call them simple small town solutions. At a meeting with a SHA executive once out here at Candle Lake, one of their senior directors said, you know what you're proposing, Terry, this sounds like it could be a quick win. So every politician is looking for a quick win,
Yeah.
something that, oh, we did this. So if we think about this, Jacob and Kyla, we're going to battle here. We're going to battle for seniors and those people that have a transportation issue. And we have a mission. That's to improve the situation for them. And that we have to do that by facilitating change. What's our ammunition? That's where we go back to our data.
Hmm.
So if we find a politician or if we find a political initiative that seems to be of interest to them, we just have to keep asking questions. Does this interest you? Does that interest you? What about this? What about that? Would you like it better if it was almost free? And when you get that and you get that interest, then you can say, oh, we have data on that. Would you like to see it?
Mhm.
And
Mhm.
then you don't flood them with a whole bunch of stuff, just what they're interested in, and you move from there. So it's about innovation and creating some quick, simple wins, some simple small town solutions for those of us in rural Saskatchewan, and doing that. And then it's about constantly thinking about quality, but doing things.
Yeah.
GSD.
Yeah.
So we need to innovate. We need to move forward quickly. And I wrote this down the other day as I was preparing for this, Carla. I said, quality doesn't improve by having meetings, by constantly talking about things. Quality improves by changing things, by doing things, by looking for simple, quick little wins, simple small town solutions, testing things, not by overthinking and being frozen in time or being frozen even in bureaucracy.
Hmm. Yeah.
So
Yeah. Yeah. Amazing. Thank you guys so much for sharing your story and your collaboration. And I'm going to link whatever resources I can find, whatever you guys have created. I'm going to put those in the show notes. So if anybody wants to learn more, they can read your reports and hopefully connect with you to get access to toolkits and keep the conversation going and keep the momentum going. So thank you so much for all the work that you've done. And I know money is a resource for sure, but like you said, time and energy and all that you've done to commit to this work is also appreciated too, and shouldn't be undercounted for the impact that it had. So thank you guys both.
Thank you so much, Kayla.
it's been an absolute pleasure. Thank you.